Women who suffer with low sexual desire often think that there's something wrong with them, that it's their fault, that they're no longer sexual. They may feel very disconnected from their own sense of sexual desire, especially if they had desire before and then they've lost it. And this can also happen at a lot of times in our reproductive cycle. So it may happen when we're premenstrual and having some symptoms there, or during pregnancy or postpartum, and certainly in the menopausal transition.
Well, the idea that women have less sexual desire than men and that we just have to accept that, it's false. Women, and particularly in heterosexual relationships, have lower sexual desire because the sex is simply not rewarding enough. They just don't get the right sexual stimulation. And if you don't expect a reward, if you don't expect that something fun will happen, obviously you don't desire it. Sex in heterosexual relationships is very much oriented towards the male sexual script, and that is focused on penetration. Now, don't get me wrong, penetration can be fun, but it's not the most stimulating and rewarding stimulus for women to get sexually aroused and to orgasm, because women need direct, indirect stimulation of the clitoris. So women need fingers and not just a penis.
Women with low sexual desire tend to get to the place where desire doesn't exist. And until women understand that there are treatments for them, they may just sublimate that and just have mercy sex, duty sex. They love their partner, and so they're having sex to keep him or her happy. But everyone has a right to pleasurable sex.
So it's really important for anyone suffering from low sexual desire to find a provider who cares about it, who understands it, and who really wants to help you. And in order for me to help you, I have to get to know you very well. And when we talk about low sexual desire, it's like in most things in sexual medicine, it's a biopsychosocial solution. So we look at the biology.
Also, sexual desire might need some time to develop. And when you encounter a sexual stimulus, it might happen that you don't have this immediate desire to act on this stimulus. But if you open yourself for the sexual stimulus, then the desire might grow. So the question is not, do I desire sex at the moment? But it's more, am I motivated to open myself for sexual desire? Just give it 10 minutes, let it explore.
So there are wonderful options for low desire, like sex therapy or certain podcasts or books that are really helpful to get your brain around, I need to make sex a priority, or I need to make my pleasure a priority. That's such a common issue that women often have, is not making their own pleasure a priority. And we do have medications that can help with low desire, quite a number of them, in fact. And so really getting patients to understand that it is not a one-size-fits-all, but what we call a biopsychosocial solution.
I am a woman who has suffered with hypoactive sexual desire disorder, which is the fancy name for low desire, for many, many years. And I've been lucky enough to be treated. And my sexual life, I'm in my 70s, is wonderful because I sought treatment and received treatment. Now, that may not be true for everybody, but you have a right to seek that treatment and make your own decision what you want to do. There are treatments out there for you. There is a possibility for you to restore a sexual life, to restore the desire that you once had if you miss it and you want it. Now, if you have low desire and you don't care, that's fine. That's your right. No one's going to tell you you need to be treated.
I think the message I would want to get across to women with low desire is that you are not broken and you're not alone. And that this isn't something that you need to suffer with in silence, and that there are actually treatment options available if this is something that's distressing and you want to get care for it.
Also consider, and this is very important, if you have sex with a partner, that it's unlikely to always want the same at the same moment. It often occurs, and especially in the longer term relationships, that one partner wants more sex or more often sex or other types of sex than the other partner. It's not automatically the lower desire partner who has then the problem and then the higher desire partner who acts as the benchmark. It's just a mismatch in sexual desires. And what couples need to do is seek for a compromise, try to actively work to broaden their sexual script and to meet each other in the middle.
Are your hormones problematic? Is your dopamine problematic? We know many medications can lower dopamine, like certain antidepressant medications. And so we look at your history, we look at what's going on biologically, and also we look at your whole picture. Is your relationship healthy? Are you happy? Are you stressed? Is your work really busy and difficult? And getting to know you, then we can understand how we can help.
And so I think one of the things that we should note is that about 10% of women have distressing low sexual desire. If your desire is low and it doesn't bother you, that's really not a problem. But if it's distressing to you, then there are interventions. There are 2 approved medical treatments for women, psychotherapy of certain types, and sexual therapy may be of benefit. And women should bring this up with their providers, because providers often are uncomfortable with this topic, not well trained in medical school, and will be happy to help if they know it's a problem. So bring it up.
Point is, you need to know that there's availability, a possibility, there's a future for you if that's what you want. Don't give up on yourself. Don't let somebody else give up for you. Just go out and find someone to help you if that's what you want.